News Center Maine is partnering with the Maine-Monitor to bring you some of the reporting being done by journalists at the nonprofit independent publication. We will be featuring one of their stories each Monday. Today, we're taking a look at guns and mental health. Suicides with guns took the lives of more older Mainers than car crashes in the period of 2008 to 2023. Experts say it's on par with a troubling trend they're seeing in rural communities across the country, where older white men are more at risk. And here to talk more about that is Emily Bader with the Maine-Monitor. Emily, thank you for being with us.
Thank you for having me.
Let's talk about this data. What does this data tell us?
Right, so we worked with The Trace, which is a newsroom that reports on gun violence, and they analyzed 15 years worth of CDC data. And what that data told us is that Maine is particularly high when we're talking about the rate of gun suicides among 70+ individuals. And I took a closer look at Piscataquis County, which was very high. It's actually higher than 97% of all counties in the United States.
What is behind these numbers from what you've been digging into?
Yeah, so there's no single cause when it comes to suicide. You know, it's a tough subject to approach, but we do know that isolation, physical illness, high gun ownership, and general quality of life are contributing factors, they're risk factors. And Piscataquis County has a very high poverty rate compared to the rest of the state. They're the oldest county in the state. They're actually considered a frontier county, which means that there's fewer than 6 people per square mile. And they do have, surveys tell us there's probably high gun ownership there. And locals say that people don't really ask for help. It's not a pride thing, it's they don't want to be a bother, maybe their families have moved away. And so it's really hard to get to people before these suicides happen.
And it's hard to access the help if you don't know it's there either.
Exactly.
So are there solutions? Are there measures in place for prevention?
Yeah, so I mean, there's multiple ways to kind of get at this, but one of the most important ways is if you think about gun suicide. So guns are the most lethal means of suicide. Very few people survive. And so you want to restrict access to those lethal means. So I spoke to the Maine Gun Safety Coalition, which is advocating for a red flag law that will allow family members who maybe have a family member that talks to them about their suicidal ideation to petition courts to take away their weapons. There's also the 72-hour waiting period. That means 72 hours between when you purchase a gun and when you pick it up. That's currently held up in appeals in Maine. But what's important about that, experts say, is that it stops the impulse. Suicide tends to be a very impulsive act, and so anything like a waiting period is helpful. There's also other things, you know, gun locks, awareness campaigns. You know, you walk into a gun shop, you see a poster for the 988, the suicide hotline, and any opportunity for intervention or to interrupt that impulse is going to be helpful.
So it sounds like maybe families can learn a lot from this article as well.
Yes, absolutely.
Emily, thank you for coming in and talking about it.
Thank you.
And you can read the full story and much more at the-maine-monitor.org. And want to remind you of this: if you or someone you love is struggling, there is help available. You can call 866-771-9276. That number's on your screen. It's the Sweetser Peer Support Line for Mainers. You can call that number 24/7. There's also the National Suicide and Crisis Helpline. That number's a little easier to remember. That's 988. You can text or call at any time.